if you want to raise a question, then either use the chat box or raise your hand, because that way we can bring you in rather than interrupting our speakers. If you want to just go back one slide, Joe, because I think I skipped over the Menti bit. We use Mentimeter as a way of helping you to be able to give us feedback as we go along, and you can use it to share your thoughts as well on some of the things we're going to present. So the easiest way is take the camera on your phone, hold it up to the screen to see that little black box, and it will give you the link to go through to the website, or you can type in mentimeter.com, and the code you want is 95777214. And we'll pop in the chat box as well, if one of the team can, the link to Mentimeter as well as the code. So Caroline's put it in. Brill. So for those of you who've not seen me before, I'm Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council. First of all, I want to just share the apologies of Councillor Paulette Hamilton, who would normally chair these sessions. Councillor Hamilton is the Cabinet Member for Public Health and Adult Social Care, but unfortunately she had another commitment tonight and didn't want to slow up the release of the profile, so she said, could I take her place and just give some words of welcome. But so unfortunately she can't be with us, so I'm afraid you've got me to kick off tonight. So we're going to talk first of all a bit about what the community profiles are, and then I'm going to hand over to Ricky to take through the detail and his team because they've led the work on this. So community profiles are part of a group of documents that the Public Health Department of the Council are producing. There are documents that we have to produce. These are our statutory documents, and there are two main documents that we have to produce every year. The Joint Strategic Needs Assessment, which is like a snapshot of the health of the city, and the annual report of the Director of the Public Health, which is an independent report where I can express an opinion on a health issue of the city to the council. So they're the two things we have to do. And then since I arrived in the city in 2019, we've been developing a series of other reports that I feel are really important. So the first are deep dive needs assessments. These are like mini joint strategic needs assessments. They're quite in depth. They involve doing focus groups with communities to capture qualitative data, as well as looking at the numbers and the published research as well. And they make recommendations for action, and they take about 6 months to do. So we only do about 3 or 4 of them a year because they're quite big pieces of work. The second thing we're doing is the community health profiles, and this one is the second community health profile, and I'll talk a bit more about what they are in a minute. And then the third thing we do, which is a really big piece of work, is what are called topic-based commissions. And that's when we spend really about 2 years working with a community, looking at the evidence, looking at the data, and really trying to get to the root of how do we change some of the inequalities. And we have 2 commissions at the moment, one which is the Birmingham and Lewisham African and Caribbean Health Inequalities Review, and the second is the Birmingham Poverty Truth Commission. So if we move on to the next slide, please, Joe. So the community health profiles. Community health profiles are part of our approach to trying to improve everyone's health across the city. They're about trying to help everyone understand the gaps, the health inequalities that affect different communities and that get in the way of people leading a healthy and enjoyable life. The profiles focus on a specific community of identity, interest or experience. So the community health profiles aren't based on geographies about where people live, but they're based on their ethnic community, their faith community, their sexual orientation or their disability. And over time, we will also start to develop them based on what we call communities of experience. So, for example, people who've been through our justice system or people who were looked after children and in care when they were younger. And the community health profiles set out the difference between the community that we're looking at and either the general population of Birmingham or the national population, and they'll be published on the council's website, and I'll talk a bit more before I hand over to Ricky about where they go up. We'll refresh them every 5 to 8 years, and that's because in most of these areas the data doesn't get updated very frequently. We're often reliant on census data, which only happens every 10 years, and there's also quite a limited research base, so there's no point really doing it every other year. So that's why we're saying we'll refresh them about every 5 to 8 years. So if we move on, Joe. Thank you. So in this year, I set quite a high bar for Ricky and the team in terms of publishing community health profiles, and some of them the team are developing themselves, and then we're also commissioning some additional profiles to be done as part of our preparation for the Commonwealth Games, with a particular focus on Commonwealth countries. So the first profile was published last month for the Sikh community. This Bangladeshi profile is the second one in the series, and the next two will be our lesbian profile and our profile of our hearing impaired and deaf communities, and they'll both come out before the end of the financial year. The deep dive reports we're publishing this year, the veterans report's already been published, the end of life one is coming shortly, and then the carers one. And as I've mentioned, we have the 2 commissions going on as well, which you can find out more information on the council website. So if we move on again, Joe. So the community health profiles are trying to summarise the data, the evidence that we have on the physical health, the mental health, lifestyle factors, so things like smoking, drugs and alcohol, as well as the things that affect our health, like our housing, employment, education as well, for the community in Birmingham, as well as looking at some of the evidence nationally affecting particular communities. We've themed them around the 10 themes that are the health and wellbeing strategy for Birmingham, which we're currently consulting on, and it's called Creating a Bolder, Healthier City. And they're pretty straightforward 10 themes, so it made sense for the profiles to align with the 10 themes. Once we produce the profiles, we do engage with communities about them, and this event is part of that. But they're designed to help communities really understand what's going on, but also giving them that kind of validated evidence base that this is what the council's saying, you know, this is what the evidence says around the inequalities. So it's about helping communities articulate where their challenges are and seeing what's in the evidence. But it's also for the council about giving our staff more of this information at hand so that when they're planning services, they can think about it a bit more. So the next slide, which Joe was just flicking onto, shows the 10 themes, and Ricky's going to highlight some of these in the presentation, so I won't dwell on them. If we move on again, please, Joe. So the community profiles are all developed using a pretty standard approach. So we look at national data and the national kind of databases and see what we can find there. We look for whether there are any reports from the voluntary and community sector. So often disease charities like the British Lung Foundation have done some very specific research with particular communities that we can draw on. We look on databases of what's called peer review publications, so published medical research and scientific research. And then we also look for, are there any other reports that have been published in grey literature that we should include? We bring that data together with anything that we can find that the council or the local NHS have, and bring that together into the final community health profile report, which the team will take you through in a minute. So if we move on again, Joe, thank you. So the way we present the profiles, we have 2 main outputs. So one, there's a Word document, which has all the evidence in, it has all the references. It's kind of, this is the sciencey bit. If you want to know the detail, you go to the Word document. And then we have a shorter PowerPoint slide set, which and a set of infographics, which pulls out the highlights. So there's a kind of, here's everything on about 4 pages usually, the kind of key points you want to be aware of. We publish them on the council website, and this one should go live, I think, tonight or tomorrow morning, for you to access alongside the Sikh profile that's there. We are committing that we will translate each community profile, if appropriate, into at least 1 other language. Now that takes a little bit of extra time, so it doesn't always come out the same time as the English version, but we are absolutely committed to doing that. We can't do it in every language because obviously that costs a lot of money. And it's also not necessarily appropriate, but we are committing to do it into at least one other language which relates to the community. And we're also doing some YouTube videos to again make another way of getting the information out there and make it more accessible. And we're launching the events through the webinars like the one we're having tonight. So hopefully that gives you a sense of how we're getting the information out into communities. So on to the next slide, please, Jay. So now I'm going to hand over to Ricky, who's led the work on this, and his team to take you through some of the details of this new profile that we're launching tonight. So over to you, Ricky, and the team.
Hi, thanks, Justin, and good evening to everybody, and thanks for joining us today. So this is our kind of second presentation of this. We did it earlier on in the afternoon with our internal Birmingham City Council colleagues and staff, and we had our feedback. So we do one internal event and one external event to highlight some of those pathways, what Justin has said. So I'm going to go into more detail in terms of what the themes are, and take out a couple of snippets of some of the key headlines in those themes. So there'll be a lot of data that's coming, that will be discussed. A lot of percentages, so I make apologies of that in advance. What I would say is that please do have a look at the bigger document at the end of the presentation, where everything's referenced, and hopefully it's something that can be taken forward. I will say at this point that we haven't gone to consultation, it's or discussion with organisations. That's to stop any political affiliations or any of the distracting conversations away from the actual piece of work. So this is a community health intelligence piece of work based on the data that's out there, and we've collated it all and put it into one single document. And how people want to utilize this piece of work is up to themselves, but this is a first of its kind. No one else in the country is doing this, and we've already done one and committed to do several others. So I'm going to pass over to Habibullah, who's the Prevent Engagement Officer, shortly to kind of start off the presentation. But I will say in the document itself, we do notify the gaps and findings within there. So the population data, for example, is using the 2011 census data. We do know that the new census data coming out will probably have a huge impact on the profile, but we're committed to update the profile, as Justin said, in a few years' time, and to have some of the other parts that some of the other kind of data gaps or ethnicity data pieces of work to help kind of feed into all the profiles later on down the line. Also, we do acknowledge the fact that in a lot of studies, Bangladeshi as an ethnicity profile might not be stated. So where in the studies that is specifically Bangladeshi, we've made that. Where it mentions that it's for the South Asian community, we've also stated that as well. So we've made it very clear where we could get the best data. So the next slide will be over to Habib. Habib, are you good to go, mate?
Thanks, Ricky. Good evening, colleagues, and thank you everybody for joining. Thank you, Ricky, and thank you, Justin, for setting the context. I'm just going to go over a few slides just to give you a background information about Bangladesh and about Bangladeshis living in Birmingham in England. So Bangladesh itself, about 50 years ago, Bangladesh was known as East Pakistan, and following liberation war with West Pakistan, Bangladesh gained status as an independent nation in December 1971. Bangladeshis celebrate many cultural events throughout the year, but the two most significant ones of recent times have been the Nauka Bais that takes place in Birmingham at Edgbaston Reservoir, and also the main Boishagi Mela, that's the Bangladeshi New Year, celebrating the Bangladeshi New Year, that takes place in East End, Aldgate in London. I know there are several other Boishagi Melas across the country that take place, not on a consecutive yearly basis, but we've had Boishagi Melas in Birmingham and in Manchester and other cities where the Bangladeshi population is at large. But London, as far as our research shows, continuously year in, year out, apart from last year because of COVID, they'll have the Boishagi Mela there. And Bangladeshis from all across the UK actually gather. There's, thousands of people actually attend the event. In terms of Bangladeshis coming over, migrating to England, a lot of the Bangladeshis moved to escape poverty and to gain better living conditions. There's about approximately 7.5 million Bangladeshis living abroad, making Bangladeshi diaspora the largest in the world. Just in terms of wide-scale migrants, to the UK, just to put things into a bit of context in terms of other South Asian communities, the Bangladeshi community kind of migrated 2 generations after the Indian community and about 1 generation after the Pakistani community. Next slide, please, John. In terms of national and Birmingham context, in terms of where Bangladeshis reside, UK is the largest Bangladeshi population outside of Bangladesh and West Bengal. According to the 2011 census, as Ricky says, almost 1% of the UK's residents identify themselves as Bangladeshi, and a large proportion of first-generation migrants are from the Sylhet region. The largest proportion of Bangladeshis living in England actually live in Tower Hamlets, and that makes up about 32% of the borough's population. Outside of London, the next biggest population is about almost 12% living in the northwest, and just above 10% living in West Midlands. The 2011 census also reported that Birmingham is home to the largest Bangladeshi community in the West Midlands. So within the West Midlands, Birmingham is the largest Bangladeshi community, and at that time, the census suggested that there's 32,500 Bangladeshis living in Birmingham. And if you can see the map, there's kind of like a darker kind of shaded reddish kind of area, which is kind of like inner city Birmingham. This is where a majority of the Bangladeshis actually live, and Ritu will kind of expand on a bit on in terms of the impact that has on the Bangladeshi community and the Bangladeshi community's health profile. The other thing to take into consideration is the Bangladeshi population in Birmingham is younger than the Birmingham general population, with a high proportion of children aged under 18 compared to the general population. So about 42% of the Bangladeshi population are under 18 compared to 26% of the general Birmingham population. Next slide, please, Joe. I think it's still me. Oh, over to you, Ricky. Sorry, that's you, Ricky.
Yes, thanks for that, Habib. So the general headlines from this piece of work is not necessarily hugely surprising. What we're trying to kind of substantiate and define and put together is decades of inequalities within the city, not just in the city but nationally as well, but giving it some substance within there. So in this sort of profile, we are looking at high rates of childhood obesity, lower rates of people engaging into drug and alcohol treatment, and lack of cultural sensitivity and language barriers for people to access services. So the next slides that we're going to be going through now will sort of identify those 10 themes that we went through earlier, and I'll be picking out a couple of the headlines within each of those themes as well. And then towards the end, I'll show you how we've summarized this bit in there. So one of the first starting points is getting the best start in life. And a couple of things that came out of this one was something that Justin Varney, when he came into the role, was around the rate of infant mortality that had been sort of a poor legacy from Birmingham, and one of the commitments was to to go and try and tackle the high rates of infant mortality within the city. And during this profile, it was found that Bangladeshis are 2.5 times more likely to have stillbirths compared to white British mothers. And the fourth point, the third point there was just 13% of children with Bangladeshi origin were obese in reception, while 30% were obese in year 6. This is key headline information really in terms of how do we communicate these issues within the Bangladeshi community in Birmingham, and as a starting point for conversations. This information was taken from a piece of work that was done by Nuffield Department of Population Health, and from Public Health England's National Child Measurement Programme from between 2019 and 2020. So this is relatively up-to-date data around the National Child Programme measurement scheme. The next one theme around mental wellness and balance. Just blocking my screen there for a second. Is showing around mental health. Obviously, was really much at the forefront through COVID. It's highlighted that the Bangladeshis have the lowest prevalence of mental health conditions compared with other ethnic groups, which was around about 8%. This was taken from 2021 data, so this year's data around ethnicity and facts and figures, and this was under the detentions of under mental health of the Mental Health Act. The second point there around alcohol, that 98% of men and 99% of women reported not to have drunk in the last 12 months, compared to the general population of 8% and 14% of women. This is taken from NHS Digital Health Survey for England. Just to kind of give you a bit of wider context in comparison with South Asian populations, if you add all of the South Asian populations together, it still only attributes to under 4% of the National Treatment Agency's figures. So all the figures, like 289,000 people in drug and alcohol treatment, only a few thousand. If you add all of those South Asian communities, actually total up to the 4,000 itself. So that barrier, as what we identified at the beginning of the presentation, of gaining access into sort of healthcare treatment systems, is really prevalent at this part as well. The last figure there around drug use, Bangladeshis are 40% less likely to report drug use compared to white British. And this was actually a piece of work that was done in East London by Jacody AA. And that was looking at illicit and traditional drug use among ethnic minorities adolescents in East London. And that was a public health endorsed piece of work as well. Which was really fascinating read as well. Going on to the next slide was around healthy and affordable food. The first 2 points were from the Health Survey for England, again an NHS document, and the second bullet point was from Public Health in England's Social Care and Obesity. So the 94% of Bangladeshi men use salt in their cooking. This is the highest out of all minority ethnic groups. And on average, this is 20% higher compared to Black African men. As you'll probably see later on, nutrition, obesity, diabetes, these are huge issues within the community, and a really good starting point in terms of where the community could kind of start a kind of journey. It was a phrase that Justin had used in one of the last profiles, which is like, if you're trying to boil the sea, as somewhere you need a starting point to try and tackle this on. The second one was, studies show that obesity rates in Bangladeshi adult men varies between 5.2% and 11.5%, a lower proportion compared to Bangladeshi women of 15.1% to 17.8%. And that's compared to the general population of men and women between 18.7% and 23%. And that data has come from directly from Public Health England. The next stage is looking at active at every age and ability. And this is kind of a very startling headlines that have come out of it. So the government recommendations that we should be doing 150 minutes of moderate activity per week. Putting that into comparisons, 34.3% of Bangladeshis are physically inactive. So that's doing less than 30 minutes a week. It's lower in Pakistanis, but higher than the Indian community. And 30 and 35%, between 30 and 35% of Bangladeshis meet physical activity recommendations. So this is lower in proportion compared to the Black Caribbean and Pakistani counterparts. When we looked at the first stage about getting the better start in life, in 2007, 68% of Bangladeshi children aged between 2 and 15 met age recommendation of physical activity. So if you think about even with schooling at that point, there was still need for physical activity that's needed. And this information has come from the British Heart Foundation and Sport England. This theme around working and learning well, the sources of information have come from 2012, the ethnicity facts and figures from the UK government, supplied by the Office of National Statistics, also the King's Fund. So in terms of qualifications, 57.3%, that's 60% of girls and 50% of boys, of Bangladeshi pupils in England got a grade 5 or above in English, maths, GCSE, and that's actually national. That's actually higher than the national average. Where that relates into kind of employment, Bangladeshis are with the percentage of 51.6% are less likely to be economically active than the general Birmingham population of 59.2%. How that's also related is 31% of Bangladeshis reported never have worked or unemployed long term, and this is over twice likely compared to the general population of 12%. In terms of household living, more Bangladeshis in Birmingham, so a total of 18%, live in overcrowded households compared to the general population of Birmingham of 4.2%. So if we looked at the map at the beginning of this presentation of where we looked at where Bangladeshis would live prominently in inner city areas, you could see in terms of the housing quality that's looked at, and we will come back to this in a further slide that's demonstrated. Which will highlight that. So from protecting the data, this information is taken from the National Office of National Statistics around sexual identity, and looking at a few other journals which I'll refer to. In terms of cancer screening, Bangladeshi women, 70.6%, have the worst non-attendance for cancer screening. That's higher than Indian, Caribbean, Pakistani, and African women. What we also have on the last point, which was taken from a document which was conducted in the early 2000s, was it was a piece of work that was done by C.J. Skinner of sexually transmitted infections in Bangladeshis. Residents in the UK, and this was a case control study, and it identified that Bangladeshis in the UK are more likely to be referred to sexual health clinics by GPs. This was suggesting that their knowledge of sexual service provisions is low. Now, as we mentioned earlier, we've already done a Sikh profile, and some of the themes are sort of do cross over, especially when it's looking at sort of the South Asian communities on a whole. So diabetes, the risk of developing diabetes is at least 2 times higher among British Bangladeshis compared to white counterparts. Looking at the third point, which was around end of life. Now, this culturally, having multi-generational households, you know, the onus and the stigma and the culture around to look after the elders. Now, this might be a little bit different if we look at some of the later data, but this was coming from 2021. A report into the end of life preferences among Oldham's Bangladeshi community showed a higher than national rate of those wanting to die at home of 87%. So the next 2 slides are sort of brought together, which are the closing the gaps and the green and sustainable future. This is looking at living in the highest 20% deprived areas in Birmingham. So this is the kind of context that we're looking at. So we looked at some of our own Birmingham data, cross-referenced it over with the census data that we have. Of all the Bangladeshis in Birmingham, 88% are living in 20% of the most deprived areas. So that's including areas of Bawdsley Green, Lozells, Birchfield, and Smallheath. We do know that life expectancy between certain parts of Birmingham to the other side, your life expectancy can be lowered up to 20 years. So where it's looked at a little bit more detail in this is that life expectancy for those with disabilities is estimated to be the lowest among people of Bangladeshi origin compared to white and all other ethnic groups. Now, we looked at some of the data and we've put this together in terms of we mapped it with 5 indicators. looking at multiple deprivation. So if we think here that we're looking at the green spaces that are around available in the city are sort of more to the north, you know, you can see the colours that are there. And where the Bangladeshi population is more central, you can see some of the opportunities of trying to do, you know, access to green spaces, exercise, all that is limited, just even based on this data that we've got. So the largest populations in Birmingham live in Lozells, Aston, Sparkbrook and Smallheath. But we also identified, like I said at the beginning of this presentation, there was a lack of published research exclusive to British Bangladeshis in their contribution to green and sustainable futures. Will that change? Hopefully, I do think so. That might change in the near future. Now, one of the areas that we were looking at was the mitigating the legacy of COVID-19. So at the beginning of the profile work that we started, Justin had identified this pre-COVID, that this was an area of work that we wanted to do. It was more and more highlighted during COVID, the need of the lack of data and ethnicity, faith data that was actually out there. And so one of the first studies that came out of this was identified in you know, with this piece of work. So the UK Parliament did an impact of COVID-19 on different ethnic minority groups in 2020, and some of the findings came out that the long-term conditions compared with white British individuals over 60 years of age, people from Bangladeshi backgrounds are over 60% more likely to have a long-term health condition that makes them vulnerable to COVID-19. The second part, people of Bangladeshi origin, 43% were most likely to report loss of income since COVID-19 pandemic. So if you're thinking about how a lot of the restaurants and the hospitality sector was affected, this is highlighting. And the last bit, which is relating to the previous slide, was looking at overcrowding. If you've got housing of multi-generation populations, overcrowding was linked with an increase of rates of mortality in the hospital-based cohort. So 30% of Bangladeshi households being the highest compared to 16% of Black African households, 18% of Pakistani households, and only 2% of white British households. So that we knew the nature of how the transmission of COVID would have an effect on a house, especially if it's overcrowded. So what we then did was, this is obviously like a very heavy document that I've just gone through, blitzed through in a short period of time, but we need it to be made accessible. So we've done two things. One, we've summarized the findings that we've put together in the infographics, what Justin was talking about at the beginning of the conversation, and this identifies the 10 themes that have been talked about. And then what we did then was to take it a little bit further and have it translated into Bengali. What we have then done to take it onto another further stage is to have the infographics and the narration of to go through the infographics translated into Sylheti, into a short video as well. So what will happen at the end of this presentation, the actual document itself will be live. I think we're just finalising just a couple of bits on the bigger report in Bengali language, because there was the latest data was just coming through, so we just added that last minute. So that might be available at any time. So we'll put that through. Everything will be there by Monday, let's put it that way. But the English version and the infographics in both languages are ready right now. So that bit's kind of covered from there. What I'm going to do is I'm just going to take a bit of a pause at this point and just open up the room for any questions.
This is Anam here. I'm involved with the Bangladeshi Regeneration Council. It's a national organization. We're looking at harnessing the power of people in the Bangladeshi community sector in the regeneration of our communities. We're working on a vision that by 2030, our communities should no longer be regarded as one of the most deprived. As you've outlined in your report, there are number of challenges that lie ahead for within our communities, and I think the voluntary sector has a greater role, and the community has a greater role in terms of filling some of those gaps. But this is where we would need the local government support in terms of how best we can do that on the ground. So I think it's a great report, and I do realise that you've collected a number of evidences, information from various other sources. I was involved with the census 2021. I was managing the census in Coventry, and we've did a lot of campaign to make sure that the Bangladeshi community's voice and the community is counted within the census, and we did a lot of campaigns, media campaign and various other stuff. So overall, I think the census was a success. We had over 97% of the community, the population taking part. So in that sense, I think we will get a clearer picture from the Bangladeshi community as well. So just to conclude, I think what I would just say that there's a lot of things that we need to do in terms of, we talked about obesity, children's health and stuff like that. But I think we need to have a greater engagement with the Bangladeshi voluntary sector within Birmingham and also within the West Midlands, and see how the voluntary sector can contribute in terms of creating projects that will address some of these concerns within our communities. Thank you.
Thank you for that. Yeah, I mean, sorry, Justin.
So I'll take boss's privilege on this one.
Yeah, that's right.
So I think just to say a couple of things. So first of all, as you saw earlier in the presentation, we're doing a lot of these community profiles, and one of the key bits is we know for many communities this is not new news. The challenge is actually no public sector bodies pulled together reports like this that says this is what the facts say. So we're hoping that communities will seize these profiles and use them to lobby, to put pressure on, to raise their voices. So it becomes a useful tool, not only to lobby the public sector, but also to use within communities to start conversations, which is why we put the extra effort into doing the translations to help ensure that everyone in the community can have a part of. I can see Dawn's put in the chat, but we work locally with several different Bangladeshi organisations that work with our Bangladeshi communities, such as Legacy West Midlands. And actually, in the last year, we've put out a series of contract opportunities, tenders, through the Find It Birmingham portal, where we've specifically highlighted work to do with either South Asian communities or specifically with the Bangladeshi community. So certainly I can only talk for Birmingham in this point of view and public health in Birmingham, but we are putting out opportunities for funding through our commissioning process. And I think it is really important we do develop that partnership, but we also look at how some of our mainstream services are better at working with Bangladeshi communities. And that's where I'm really hoping these community health profiles will be used by you in the community to knock on doors, to say, look at this document, what does it say, what are you doing about it, and to hold the public sector to account. So that's really at the root of what we're trying to do as well.
Is there any other comments coming through? I think Anam, were you going to say something there? Because you just
no, I think it's great. That I think but in terms of sometimes we do have to take that extra bit of effort from the public sector. I mean, it's a great thing that you've done this. I don't think not many other local authorities have done that. But I think the next stage would be just to make sure that there is a structured way that we can deal with this problem. And I think we can't, just rely on volunteers in Bengali, because Bangladeshi voluntary sector needs that capacity building for themselves. So I think, continue to work with the sector. But I think there probably needs to be a bit more structured way in terms of how how we can deal with that problem. And I think perhaps that kind of conversation that we can have later on to see what kind of structure that we can put in place from within our sector, within the Bangladeshi community sector, working in partnership with the public sector and also the business sector as well, to mitigate that problem. So hopefully in 5 years' time, as I think Justin mentioned at the beginning of the presentation, that you're going to do another kind of review on that. So I think perhaps we have a better picture of the health opportunities within our community. So yeah.
Yeah, and that's fine. And we've got a little mini exercise with Menti where we actually sort of put that offer to people in this room, to basically say how would they sort of make sure that they would cascade this information out to their peers and networks as well. And also, how do we measure the success of the profile to see whether it's not just something that's just left on a desk and ignored. We want it to be sort of utilized and a starting block for a lot of people. Now, the Menti code is back in the chat again, so Caroline's just put it on there. I'm just going to go back to Shamach K, his question. What can schools do to support parents? Can you just give a little bit more context on that, please, on that question? Because I'm not sure how you want that how that relates to it. In the meantime, Neil's got his hand up. So, Neil.
Thank you. My name is Neil Atkinson. I work for Birmingham and Solihull Mental Health Foundation Trust. And if I picked you up correctly, you were saying the lowest Bangladesh community has the lowest prevalence of mental health conditions. I was intrigued by that. Is that, did you kind of explore that further? Is it about reporting? Because obviously we're very interested in how to support access into mental health services. And I just wondered if you drill down any further into that.
Yeah, so the actual piece of that, the actual document was around from more of a criminal justice retention around detentions under the Mental Health Act. There is a section in the bigger report which is drilled down to some more of the reasons that have been indicated. I haven't got that to hand at the moment. It's more into the document itself where it's explored.
Thank you. I have one follow-up, if that's okay.
Sure.
I'm interested. There's been some comments about voluntary sector, and I'm really interested to know, because we're involved at the moment in developing primary care mental health services, and are there any, or does anyone know of any voluntary sector organisations that are directly involved in the Bangladeshi community in terms of providing mental health support? Because we would engage with them.
None that come to the top of my mind, which doesn't mean that they don't exist. What we could do is trying to reach out to with some of our networks that we've already got at BCC to see whether somebody does that. But the room is open if there's anybody else who says any other organisation that they're aware of to link you with Neil. So we've got Dawn, who say Legacy West Midlands there, Kafila. She's talking about Bangladeshi women at Tividale. So that's just outside of Birmingham from the South Kiao. So hopefully, Neil, that sort of answers your question within there. We'll still do that exercise. It might be just me with a lack of knowledge on that particular bit that gets commissioned. It's not my area that I look at in particular.
Okay, thank you.
Anybody else with any other questions? I'm gonna go for Alice.
Hi. I think this is a fabulous piece of work. So I'm from Health Visiting Birmingham, and I think going forward this could really be utilised. My question was, I've got two questions actually. One, is it just on adults? And the second question was, is there any qualitative data being used? So kind of the evidence base and literature review, kind of, in terms of methodology and stuff. Thanks.
So I'll answer your second question. The whole document is based on from an evidence-based point of view. So it will give you that structure to base it on. In the themes that we've identified in the actual document, it does break it down. One of them is getting the best start of life in life. So that's obviously looking at young people, children, and younger adults. So there is that section in there. I mean, like there could be other themes that we might add in the review later on if something's more that comes out more and more. you know, because we are looking to build up in terms of kind of youth engagement within public health. But there isn't anything, or what I would say is in the document, you'd have to go through the document to see which parts are more relevant to you, you see.
Thank you.
No problem. Okay, I'm going to go on to Menti at this point. If you look onto the screen, so if everybody can go onto menti.com, and if they can input the code there, which is, sorry, I've just been I've recently been prescribed some glasses now, so I understand why I've been given them. So it's 96. That's it. Thank you, Caroline. You get extra day annual leave. 9577 7214. And that will bring you onto this screen at the moment. Joe, are we able to move on to the next one? So what we want to do also is to have, we're going to pull off a bit of reporting for our own in-house engagement around some of the demographics that people are, you know, from this session. So there's a few questions that we're just going to be asking now. So what is your age? Tragically, earlier on in the day, I realised I actually fall in a new age bracket on here. Okay. So everyone's young at heart, let's put it that way. Okay, Joe, next one. How would you define your ethnicity? So it does take a bit of time for when the answers get put up. Bangladeshi, British Bangladeshi, white British. Okay. White British. Okay, next one, Joe. What is your religion? Okay, so we've had 10 people reply to that one. So little trick, I know how many people are replying in the corner, so that's great. Next one. I'll just give it another 5 seconds. Okay, Joe, next one. So this is where we're looking at what areas of the city that we're looking at. So all we need is your first part of it. So B21 was my first bit where I was living in Handsworth. Lovely, lovely. Okay, Joe, so it will allow you to answer these questions at your own pace as well. So, okay, so here comes one of the first questions that was sort of we were discussing in this forum. So how would you or your organization cascade this information out into the Bangladeshi community with key stakeholders? So just take a second, think about that, and then how would you cascade it? So there's areas that, you know, we've got a limited sphere of influence, what we would do. So we'd be sending it to the communications team. Okay. It's a bit of an easy answer, that one, isn't it? Anyone else got any other suggestions? Through community engagement events, wellbeing workshops and presentations. Right. Social media is a platform. So getting the right influencers to highlight it. The brccouncil.com. So to set up an internal forum. Okay, so for this to be presented there and to be shared through our family and fit program with partners through community engagement and social media. Yep. Linking it with other professionals, matching it with patient records, make it with health service. Okay, the next question. So out of the conversation, we've already heard somebody who was talking about how they would kind of utilize it. What opportunities do you have to embed the key findings in your particular line of work? I'm not guessing we will have floods of answers with this because it might be a more reflective piece, but is there anything that comes straight to mind? It might be related to kind of like consultations or needs assessments or gap analysis exercises, new health project design, come present to patient groups, funding applications and planning directed at family health organisations. Okay. Okay, thanks for that. Next one, Joe. So what this was looking at was the health inequalities that was highlighted at the beginning of the exercise. So this is a chance for you to kind of rank what's most what you might prioritize as importance for the Bangladeshi community. So what you'll see is as people start ranking this in an order, you'll see what kind of priorities people will be looking at. So we've got, what would you class as the highest risk? Is it high rates of childhood obesity? Would it be cultural language barriers experienced by Bangladeshi community? So what we got first at the moment is low awareness of, I can't read, sorry, that bit. So as more and more people put their answers in, you can see it will start changing around in real time.
Sorry, Ricky, could I just interrupt, please?
Yes, is that Alex?
It's Alex. Yes.
Alex, hi, Alex.
This is really, really good. Are you going to share the Mentees perhaps in a week or two when you've had a good look at it? It'd be really interesting for us to have a look through.
Yeah, I'll be honest. When we did it with one of the other profiles, and we didn't get the greatest of engagement at that bit. So what we've done is we focused a bit more on here, and if it's sort of, if we've got enough people to come in and it's validated, then we will put the themes through 100%.
Okay, brilliant. Thank you.
Okay. So so we've got sort of a tie at first and second at this point, which is what people are classing as important. Sorry, just one's just taken over, which is like the high rates of childhood obesity, closely followed by the higher risk of maternal mortality, and the last, and go all the way down to lower rates of physical activity is kind of like the sixth priority, highest priority. And that might fluctuate depending on the group that you have or people sort of adding into this. But it's all really, really good information for us to have a look at. The next one, Joe. So what in terms of sort of the ideas in terms of engagement at this point, what we're looking at is more of community intelligence of bringing this all together. We've already sort of talked about a little bit around platforms of sharing it. But what other bits that have we missed in terms of what engagement looks like, especially working with the Bangladeshi community? I know it's coming up to 7 o'clock and you still got to use that brain just for a little bit longer. We've got some, so women's voice, faith organizations. Yeah. This is a little bit different in visuals. It's a kind of a word blurb. Mental health. So these are talking around, some of these are topics in some organizations. What will be coming through? Accessible to communities, women gatekeeper solutions. Okay. I'll accept that from this bit now. Voluntary sector engagement. And sort of the last one, how should we measure the success of the profile? Because this might be good right now and the plaudits are there, but how are we going to measure that, the impact? Improved health outcomes, yep. Survey in 12 months, okay. Okay. Compare future findings to current report. Review. How many organisations actually because of it? Reduction in that. See. Compare findings to current report. Okay. All right. Next one, Joe. I think we should be coming towards the end. So we kind of measured it at the beginning, and this is just an opportunity for you to kind of, on a scale, to basically how do you feel from after this report? So we've got a few 9s, 10s, 8.3. The lower it is, I'm going to just put it down to time. So we've got 8.1. Okay, I'll cut it at that point, but that was significantly higher from our first point, so I'll accept that. Justin, over to yourself for any sort of last comments around this.
Great, thanks, Ricky, and thank you everyone for joining us. It's really great to see so many people giving up some time in their evening to come and hear about this. As Ricky and the team have said, we are breaking new ground here. These community health profiles are pretty unique in terms of the approach we're taking, and we're producing a lot of them this year. But I do take on board that real challenge about how do we make sure they're used? How do we work with communities and with those that are already in those communities to make sure that they're used and taken forward in conversations within communities? Because part of actually responding and closing the gaps is giving the information, giving the evidence, giving the tools to people in communities themselves so that they can raise their voices and make difference within their own communities, and working with partners in the public sector and the private sector. And also I hope that any of you who've got links into universities and academia, with all of these profiles, each time, the thing I am so shocked about is how little research is done in the UK into these issues in specific communities. And that's really, it's unacceptable. Communities like our Bangladeshi community have been in the UK for many, many years. And yet what we've really shone a light on is we know very, very little about the health of our Bangladeshi population in the UK. And that's not okay. So it's really important we lobby academics and research funders as well to close those gaps for the future. So I hope you find the resource useful. The link's in the chat as well. I've checked, it's live. The translated versions will be going up in the next couple of days as well, and the YouTube videos will follow on. And I hope you will work with us to keep these live in communities and make sure they're things that are being used, because that's really important. So have a great night, everyone. Thank you very much for spending time with us this evening. And I'm great to see this report launch. So thank you very much, everyone, and good night.
Thank you.
Thank you. Bye-bye.